Today I would like to introduce myself. I'm Dr. Srilatha. I'm an emergency physician practicing in Hospital Putrajaya. My journey of clinical hypnosis started when I had my mom diagnosed of multiple myeloma. So that got me interested in learning hypnotherapy and helped her a lot in accepting the news, beginning from breaking bad news into positive thoughts and pain management actually. So I would like to share this, and we'll start with introduction to what is hypnosis all about, because most of the people that I meet is either skeptical or unsure, and they give funny comments about it as well. So let's do a sharing session today to enlighten everyone that's attending today in our CME. So the common taboos that I usually hear from common people or even medical professionals is like, is this like some kind of brainwashing technique, or the terminology pukau, like black magic, or under the control of another person. Like sometimes you see this in movies as well, right? So these are the wrong beliefs that you always see, like how Count Dracula pukau the victims, right? Yeah. So actually hypnosis is a sleep-like state. So you will be aware of your surroundings and the conversation that you will be parting in a deep relaxed state, and there is a small possibility that you do fall asleep. And when this happens, we as hypnotherapists, we will wake you and continue the session. So it's not going into a deep sleep and you become like totally unaware. It's focused awareness. So the myths and facts that we usually hear, the first question I heard from my colleague yesterday was, I'm afraid I will spill out all my deepest and darkest secrets. Yeah, so that is the thing that is that's mentioned by most people that I know. So the hypnotized person cannot do something that they choose not to do. Alright, so as hypnotherapists, we will guide the patient towards your desired result. So there will be some kind of a consultation first on finding what is the actual problem, a proper history taking, and a diagnosis and a plan on the therapy. So that is your desired result, the goals of therapy. And we will not deviate from the intention of the session. So no way I will know your deepest secrets. You are always aware, and a hypnotherapist cannot make you do things you do not want to do. You cannot cloak like a chicken on the stage like you see in those YouTube videos, or you cannot sign me a check and give me all your money or your properties. Okay, the second myth is people lose consciousness and have amnesia. So most people remember everything that occurs in the session. They are fully aware because we achieve a medium depth trance state called the alpha state, where the patient is very relaxed, similar to a meditative state or a daydreaming state. The third one is it possible to be hypnotized against your will? That means you really don't want, but people force you to get this therapy. Alright, so anyone actually can actively resist. Anyone who actively resists cannot be hypnotized. It has to be something that you understand and you're willingly wanting to do to achieve your goals of therapy. It has to be a willing participant. So allow yourself to relax in order to reach the alpha and theta state of mind. And some people say, hey, I cannot be hypnotized. Well, most people don't realize that it's a natural state of mind, especially if you realize when you drive to work. You don't realize by the time you start the ignition and you reach your workplace at the parking lot, you're not actually actively thinking where did you take the turns and where did you stop at the traffic light. It's an automatism, right? So that is like a daydream state. So like meditation and losing yourself into a very interesting book or movie, you just get hypnotized. That's what hypnotized about, okay? Then we go into autopilot when doing all these daily chores that you usually do. So everybody can be hypnotized as long as you are willing. So in a nutshell, it's a focused state of awareness, a sleep-like state, not in deep sleep, subconscious level, positive suggestions bringing about positive results that you want with high motivation that has been demonstrated. Focused awareness and focused concentration. So if you can see, this is where you have your conscious mind, 10% of your brain activities, like you wanting to have that willpower, long-term memory, logical thinking and critical thinking. But what we want to achieve is the 90% of your function that is in the subconscious mind, where you can actually get positive results. So this includes your beliefs, your emotion, habits, values, fight or flight, long-term memory, and so on. So back to history, I'm sure you have heard of Avicenna, like Avicenna Medical Center. Okay, so father of early modern medicine. So it's golden times of Islam and Muslims, where this philosopher and physician was the earliest to make a distinction between natural sleep and a state of hypnosis. It's mentioned in the Book of Healing. He referred this as a working illusion. In the 18th century in Paris, hypnosis was regarded as modern science. It is a medical tool in dealing with pain-resolving troubles. And John Elliotson, a president of Royal Medical and Surgical Society of London, he's the first person in Britain to use and promote stethoscope and first to use acupuncture. And he successfully performed 1,834 surgeries under hypnosis. It's also known as mesmerism. And then James Esdale, in the 1800s, famous British surgeon, did 2,000 operations including amputation under hypnoanesthesia. We also know this as hypnosedation, going through procedure without feeling any pain. Milton Erickson, psychologist and psychiatrist, also another famous figure in medical and clinical hypnosis. And also in a medical journal of Babylon in 2014, the keywords are hypnosis and hypnotherapy became a well-established medical procedure all over, thoroughly investigated, taught, learned, and clinically practiced. Psychology, psychiatry, and neurological schools, faculties, departments, and units of healthcare, they all kind of practice on this alternative way of treatment. Hypnosis and hypnotherapy. It's good in building good habits. Say you are so lazy to do exercise, we can help you with that, to regularly exercise, improve study for children, bad habits like stop smoking, nail biting, or even overeating, weight management. It's a help for this metabolic syndrome and so on. Okay, and then setting goals and following plan of action, eliminating negative talks and unnecessary fear and phobias. And then it can also help in improving performance in sports, music, acting, and so on, teaching self-help tools and techniques, healing emotional pain, pain management, childbirth. Many have experienced this. I would like to share you something that I did early this year, sports hypnosis for the National Malaysian Underwater Hockey national players. This batch of our youth team were having a trouble with the elite team from other countries, and I did a session for them and they did very well after that. Hypnosis and hypnotherapy is a significant clinical tool in medical practice in the past and present, with the hope that one day it will become a therapeutic choice for all who may need it. It can be individuals, it can be for you and me, families, groups, for healthy living, happiness, and much better promising quality of life. I believe in multimodal psychotherapeutic approach in pain management. There's many etiological factors, components, complications arising from traditional treatment plan with analgesics or any other cancer treatment as well. And many are stress-related side effects of pain. It is logical that a multimodal psychotherapeutic approach to pain management is the appropriate way to go about. This is another activity that I did in my emergency department in Putrajaya Hospital. Eye movement desensitization and reprocessing, Emdr therapy. It was originally a form of psychotherapy developed by Francine Shapiro, designed to alleviate distress associated with traumatic memories. I used this for a case of hyperventilation, and I repeatedly performed this for hyperventilation with positive results. This eventually reduced the length of stay in the emergency department and unnecessary investigations. Mary Elizabeth Fay Monville is a specialist in anesthesia and ICU care. In 1992, she introduced hypnosedation. In 1994, she taught hypnosedation in University of Leeds in European countries. Original clinic approach of use of hypnosis in surgery, chronic pain, oncologic and palliative care. This has enabled her to promote hypnosis as an interesting tool in modern medicine. Dr. Aurore Marcoux from Paris. She had a paper on minimizing effects of anesthesia on vital function while preserving patients' well-being, contributing to sustainable development of anesthesia. Hypnosedation was used in breast surgeries, including total mastectomies. This represented 90% of surgeries in this study, and gynecological surgeries, colonoscopies, and superficial plastic surgeries. And I did hypnosedation for my emergency patient with dislocated patella, the kneecap. So I settled her, and I think less than half an hour she left the department. Without any PSA, no procedural sedation, which of course you need to assess the patient and think about the complications and monitoring after that. So I did not need to use that. So what can we offer? Hypnotherapy in palliative care to reduce symptoms of cancer patient associated with radiation, chemotherapy, such as pain, nausea, fatigue, hot flushes, sleep dysfunction, and acute and chronic pain management. PSA, hypnosedation, breaking bad news. This is a very important point when you initially break a bad news to the patient and the family. Depression and anxiety will follow after a bad news, so we can help with that. End of life care, palliative care, family therapy, and compliance to follow up and medication, diet and eating habits and weight management, and eliminating fear and phobias. We can use it as an adjunct to your therapeutic goal, a quality health care for patient, family, and even staffs. We cannot change the outcome, but we can affect the journey of our patients. Thank you.